Yes, my dear doctor, I'd like to talk on a very important topic, that is an adult onset steel disease. Just follow me what is written in your notes, right? Here's the Yamaguchi criteria. According to them, there are two major criteria, at least the five total minor or the five total criteria can be present. The major criteria includes that the fever greater equal than the 39 degrees centigrade or more equal 1 week, arthralgia arthritis more equal 2 weeks, and typical rash, there is a leukocytosis greater equal the 10,000 with greater equal than the greater equal the 80% of the granular size. Minor criteria including the sore throat, then the lymphadenopathy, hepatomegaly, splenomegaly, abnormal liver function test, and negative anti-nuclear antibody and rheumatoid factor. And in 2002, that the total criteria, the 4 or more major criteria, 3 major criteria plus the 2 minor criteria. Major criteria includes that the spiking fever, arthralgia, transient erythema, pharyngitis, polymorphonuclear leukocytes greater equal 80% and glycosylated ferritin less equal 20%, and minor criteria, the maculopapular rash and leukocytosis. Yes, my dear doctor, I would like to give you an SS box of the adult onset steel disease. Just look at the board. And this discussion is really important, right? This starts with the SS box, that is adult onset steel disease, right? So I'm saying the adult onset steel disease, I'm saying the triad that we need to remember. The triad is the fever, rash, arthralgia. So adult onset steel disease, if I'm saying, this is very important. So the triad, if I'm saying the triad, so A stands on the arthralgia. Yes. And L stands on the salmon pink rash, along with the adult onset steel disease, along with the S for, once again, the spiking fever, is a diagnostic suspected that the adult onset steel disease. So my dear, listen very carefully. The triad is said that the fever, spiking fever, fever, rash, arthralgia. If I'm saying the fever, rash, arthralgia, you see that the fever, then the rash, and then talk about the arthralgia, the typical triad of these diseases. So we now add some of the pictures of this onset steel disease. The fever says that the quotidian spiking fever. We can write the quotidian and typical variety of the spiking fever is greater than 39 degrees centigrade or greater than 102.2 degrees Fahrenheit. Just write down the way I'm writing, my dear. Here's the rash is the maculopapular, and the florid rash, that is the salmon pink, the maculopapular rash. So along with the rash that we are writing, there is a maculopapular rash we are writing, and having Kobner phenomena, yes, phenomena around the trouser line. If you're writing trouser line, the patients will have the syndromes, right, the features, trouser line, and usually over the limbs and trunk, typically the rash will have these pictures. And along with these, of course, that the adult onset steel disease, of course, that another important, that is the WCC count greater than 15 into 10 to the power 9 is also an important point here. So it's said that the criteria, these are the major criteria, we can say these are the major criteria. we can write the major criteria. And now it's written plus the 2 of the minor criteria, plus 2 of minor criteria. So we put the minor criteria as the stills. These stills will be helpful to remember to all of them together. So let's see. So yes, I'm writing the as tense on the one of the important points, that is the serositis. The patients are come up with the serositis, the pleuritis, and the pericarditis. Pleuritis and pericarditis. And as for sore throat, and then the S for splenomegaly, and also the hepatomegaly as well. The way I'm writing, my dear, just write them down. Then the T stands on, one of the important points, the T stands on the to exclude. To exclude 2 important diseases. 2 diseases by 2 antibodies, that is the rheumatoid factor and antinuclear antibody, the group of disorders that we are exploring. And I stands on the, yes, the rising the inflammatory markers, are increased and increase the inflammatory markers. Once again, the most important thing is the ferritin. I'm saying the iritin, no problem. We can write the ferritin is one of the important, is the iritin, means iron. Just write down, these will be helpful, my dear, to remember. Pills, right? L stands on this, very important, the LFT, durance, with the liver function test durance. And last L, double L, L stands on the lymphadenopathy. We call it LN plus, maybe generalized, maybe cervical lymphadenopathy, and biopsy may show that the reactive changes. And these reactive changes, once again, can exclude the important disease of lymphoproliferative disorders. Write down the way I'm writing, my dear. So yes, there also says Steele disease, once again, the box that already we learned them all together. So this is very important to talk on them. This is the serositis, there is the pleuritis and pericarditis. The pericarditis, definitely there may be the ECG and echocardiographic features may be given the patients having the clinical pictures of pericarditis. So having ECG and echocardiography shows the features of, here's once again, the pericarditis. Yes, pericarditis, the ST elevation, but these are concavity upwards, the ECG pictures of pericarditis. And echocardiogram, pericardium will be high echogenic structure of the pericardium, highly echogenic, maybe some amount of fluid will be there, maybe the pericardial effusion. So these ECG and echo pictures of pericarditis may be there, along with the serositis evidences. All right. Hello, my dear doctor. I'd like to talk on the adult onset Steele disease. Just follow me what is written in your notes. Adult onset Steele disease is a systemic inflammatory condition of unknown etiology, but often thought to be secondary to infections trigger or on a background of the genetic predisposition. It classically presents in young adults under the 40 years old, peaking between 15 to 25 years, with a daily fever and a new non-pruritic rash. The most sensitive diagnostic classification is Yamaguchi criteria, defined by a patient presenting with all major criteria and at least 2 minor criteria. So major criteria that the fever greater than 39 degrees centigrade over the 1 week, arthralgia arthritis lasting 2 weeks or longer, and non-pruritic or maculopapular rash, salmon colored, found on the trunk or extremities, particularly during the febrile episodes. Leukocytosis greater than 10,000. Minor criteria: sore throat, lymphadenopathy, hepatomegaly, splenomegaly, abnormal liver function test, negative NA or rheumatoid factor. A number of features in the history and examination should point you towards the adult onset stale disease. The nature of the fever is quotidian. AOSD fevers tend to spike daily or twice daily. Secondly, the location of the rash is also characteristic. The most commonly a salmon-colored rash in the trunk and the soles and the palms and the face. Knees, wrist, ankles are the most common signs of the arthritis and arthralgia. Ferritin rises are characteristic of ASD or AOSD, observed in up to 70% of the patients. Mild elevations in ALT, alkaline phosphatase are also characteristic for adult onset stale disease. However, the patient does not describe a sore throat, which is often severe and non-suppurative in up to the 70% of the adult onset stale disease. Treatment of adult onset stale disease involves the systemic immunosuppression, initially with prednisolone, followed by DMRS. I would like to talk on the treatment of adult onset stale disease more further. That is, the evidence is very strong to support the use of interleukin-1 inhibition for adult onset stale disease. A review of the published data estimated the overall remission rate at over 80% and complete remission rate at approximately 66%. Anakinra competitively, circled the anakinra, inhibits the action of the interleukin-1 by binding to the interleukin-1 receptor, and plasma levels correlate well with the interleukin-1 in synovial fluid and presence of synovitis. Rituximab is usually instigated in patients who fail to respond to anakinra. Yes, my dear doctor, I'd like to give a box of SS box for the treatment of adult onset stale disease that is really helpful. So I'm writing the treatment, the diagnostic criteria, and the investigations. After that, we will write the treatment here. SS box for adult onset stale disease. So, yes, this adult onset stale is having an arthritis, we have seen, or arthralgia starts on the A for arthritis. So we can start the treatment of NSAIDs. The first line treatment should be start with the NSAIDs, NSAIDs, all right. And then the treatment, if it's severe, then we can steroids, we can use the steroids. And then this is the stepwise treatment, so we need to know number 1, number 2, stepwise, number 3, then DMRs, disease modifying anti-rheumatoid drugs. So DMRs, these are basically the methotrexate or sulfasalazine. And number 4, if it is not, then we can turn in like the anti-TNF, like the etanercept, tinfliximab is the infliximab, adalimumab, and also the etanercept. That will be discussed in the chapter of rheumatoid in rheumatoid arthritis topic. And then after that anti-TNF, then we can use the anakinra. This is nothing but the interleukin-1 inhibitor. And number 6, then next is the anti-CD20 drug, that is nothing but the rituximab. That is rituximab. So this is the treatment box of adult onset stale disease. We need to learn them together, all together. So a little discussion here is really needed to learn all them together, my dear. This is very important. What I'm saying, there is an adult onset still disease. I'm saying AOSD. Yes, this is the AIDS, means the anti-inflammatory drugs, because yes, you see that the arthritis and arthralgia, we can say the arthritis, arthralgia. And of course, you see we have the S for steroid. Here is the S. We can use the D for disease-modifying drugs. We can use the disease-modifying drugs. So we have at least the ASD. We can say also adult still disease. At least these 3 drugs we can remember all together. And also next is an A, next is an A, and next is A. But these are the serials of anti-TNF alpha blockers, TNF alpha blockers, anakinra, and anti-CD20, that is the rituximab. But it said that immediately after the use of the anti-TNF that we can use the anakinra. Anakinra is nothing but the interleukin, yes, interleukin-1 inhibitors. So the summary talk here, the adult still disease, the treatment, nothing but the ASD that we need to remember here. And also I'd like to talk about the adult still disease, the clinical features or diagnostic criteria that we need to know. Yes, the measure criteria, all the measure criteria should be present here. And all the criteria are the A for arthritis, S for summon pink rash, and S for spiking fever. Arthritis, summon pink rash, and spiking fever, my dear, is the most likely measure criteria. Having a WBC count is more than, once again, the 1.5, and some books write more than 10,000, no problem. Having the 2 of these minor criteria, the stills, the word will be helpful to remember, my dear, the minor criteria. Starting with the S for serositis, sore throat, and splenomegaly. So this is the S bundle pack that we can remember all together. And T for to exclude the 2 important antibodies, the group of disorder, that is the T stands on, yes, to exclude the disease rheumatoid factor antinuclear antibody. And I for, once again, the increase the inflammatory markers, and we can write the IDT, means the ferritin. IDT or ferritin levels should be increased, and it said that sometimes it's more than 1,000. So I just like 1, so we can remember the 1,000, my dear. Next one is the L stands for the LFT durans. Here's the ALT, alkaline phosphorase, they can be duranced. Next, L stands for the lymphadenopathy, but this lymphadenopathy is a reactive lymphadenopathy. This can be generalized or cervical, and the differential diagnosis of the lymphoproliferative disorders. So here's my dear, the Still's, once again, the adult onset Still means the Still's disease, and having suspected the investigation and the diagnostic criteria, there is the major criteria, all major criteria, having the minor criteria, 2 minor criteria, at least all the features, then the treatment box will have the AOSD, means the ASD will be helpful. So somebody told the box is the diagnostic criteria, that is the AOSD, that we need to remember ASS, that is the diagnostic criteria for the major criteria, and minor criteria, the stills. Once again, the major criteria, minor criteria, major criteria, minor criteria, major criteria starts with the ASD, means once again, at least we need to remember adult onset still disease or adult still disease, at least ASD. So what I'm saying, the A for arthralgia and arthritis, S for spiking fever, S for summon pink rash. Once again, the WBC count more than 10,000, along with the stills, S for at least the serositis, sore throat. You see the splenomegaly and hepatomegaly. Once again, serositis means the pericarditis, pleuritis, sore throat, serositis, fillet, sore throat, serositis means the pericarditis, pleuritis, splenomegaly, and hepatomegaly means these three pictures from down to top to down. And to exclude the two important diseases, T4-2 rheumatoid factor and anti-nuclear antibody, that we need to exclude these two group of disorders. And I for increased inflammatory markers, that is I means 1000, remember. So yes, once again you can remember the ferritin level is greater than 1000, L for LFT durance, and next L for the lymphadenopathy, that is reactive variety. So once again, adult onset steel disease or ASD is an AS, A for arthralgia, S for summoning, S for spiking fever with the WBC count in the steel, S for sore throat, serositis, splenomegaly, T for to exclude the two diseases by the rheumatoid factor anti-nuclear antibody, I for increase, I for 1000, remember my dear, and L for LFTs and L for lymphadenopathy. All them together. Now we are talking about the treatment altogether. Once again, the ASD, I'm now just making out the ASD, yes, once again, that is the A for ACE means the anti-inflammatory drugs, steroids, DMRs, anti-TNF, anakinra, and anti-CD20 rituximab. These are stepwise management planning that we need to know. Means when you start with these NSAIDs, then steroids, then you try with the DMRs, methotrexate and sulfasalazine, then after that anti-TNF, anakinra, anti-CD20. So anti-TNF, anakinra, anti-TNF, anti-TNF, anakinra, and then anti-CD20. Anti-TNF, anakinra, anti-CD20. These are stepwise management plan that we need to know. I hope that, my dear, this adult steel disease, ASD, AS, and also the steels is the summary box here. Number 2 is the steels that we need to remember, and third talk is the ASD. The treatment is ASD will be helpful. Thank you very much, my dear. I hope that you enjoyed. Thank you once again. If you like our videos, don't forget to subscribe our channel and click on bell button to get more updates.